CEN Test Prep Exam Demo. Question 1. Which finding is consistent with an anterior shoulder dislocation? Option A. Arm held in internal rotation and adduction. Option B. Arm held in external rotation and slight abduction. Option C. Patient unable to flex the elbow. Option D. Numbness of the medial forearm. The correct answer is option B. Arm held in external rotation and slight abduction. Question 2. A patient presents with a painful, red eye, cloudy cornea, fixed mid-dilated pupil, and increased intraocular pressure. The nurse suspects option A. Open-angle glaucoma. Option B. Acute angle-closure glaucoma. Option C. A conjunctivitis. Option D. Uveitis. The correct answer is option B. Acute angle-closure glaucoma. Question 3. To calculate cerebral perfusion pressure, CPP, the nurse needs to know option A. Heart rate and blood pressure. Option B. Mean arterial pressure, MAP, and intracranial pressure, ICP. Option C. Respiratory rate and oxygen saturation. Option D. Central venous pressure and cardiac output. The correct answer is option B. Mean arterial pressure, MAP, and intracranial pressure, ICP. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. The emergency nurse should have a high index of suspicion for an occult eye injury in a patient with option A. A scalp laceration. Option B. An orbital wall blowout fracture. Option C. A nasal fracture. Option D. A mandible fracture. The correct answer is option B. An orbital wall blowout fracture. Question 5. The clinical finding that differentiates a massive hemothorax from a simple pneumothorax is option A. Absent breath sounds. Option B. A dullness to percussion on the affected side. Option C. A tracheal deviation. Option D. Subcutaneous emphysema. The correct answer is option B. Dullness to percussion on the affected side. Question 6. A nurse witnesses a colleague diverting narcotics. What is the appropriate initial action? Option A. Confront the colleague directly. Option B. Report the observation to the charge nurse or manager immediately. Option C. Document the observation in the patient's chart. Option D. Call the police. The correct answer is option B. Report the observation to the charge nurse or manager immediately. Question 7. The preferred medication for rate control in a patient with atrial fibrillation and rapid ventricular response who has heart failure with reduced ejection fraction is option A. Diltiazem. Option B. Verapamil. Option C. Metoprolol. Option D. Digoxin. The correct answer is option D. Digoxin. Question 8. Le Fort fractures are classifications of fractures of the option A. Mandible. Option B. Mid-face and maxilla. Option C. Orbit. Option D. Nasal bones. The correct answer is option B. Mid-face and maxilla. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. A patient with suspected bowel perforation should have which initial diagnostic study? Option A. CT scan with contrast. Option B. Abdominal ultrasound. Option C. Upright chest X-ray. Option D. Colonoscopy. The correct answer is option C. Upright chest X-ray. Question 10. Which pupil finding is associated with uncal herniation? Option A. Pinpoint, non-reactive pupils. Option B. A unilaterally dilated and fixed pupil. Option C. Bilateral mid-position and fixed pupils. Option D. A constricted, sluggishly reactive pupils. The correct answer is option B. A unilaterally dilated and fixed pupil. Question 11. The purpose of administering surfactant to a patient with ARDS is to option A. Bronchodilate the airways. Option B. Reduce alveolar surface tension and prevent atelectasis. Option C, decrease pulmonary capillary permeability. Option D, increase mucociliary clearance. The correct answer is option B, reduce alveolar surface tension and prevent atelectasis. Question 12. A patient is brought in with decreased consciousness after being found outside in cold weather. Core temperature is 30 degrees Celsius 86 degrees Fahrenheit. What ECG change is the patient most at risk for? Option A, atrial flutter. Option B, prolonged QT interval. Option C, Osborne, J, wave. Option D, ST depression. The correct answer is option C, Osborne, J, wave. Question 13. A patient bitten by a rattlesnake develops severe pain, swelling, and ecchymosis at the site. The priority intervention is option A, application of ice to the bite. Option B, incising and suctioning the wound. Option C, application of a tourniquet proximal to the bite. Option D, administration of antivenom, crotality. The correct answer is option D, administration of antivenom, crotality. Question 14. Sudden, painless loss of vision described as a curtain coming down over the eye is a classic presentation of option A, acute glaucoma. Option B, retinal detachment. Option C, corneal abrasion. Option D, cataract. The correct answer is option B, retinal detachment. Question 15. Testicular torsion is a surgical emergency that requires intervention within option A, 24 hours. Option B, 4-6 hours. Option C, 2-3 days. Option D, it is not a surgical emergency. The correct answer is option B, 4-6 hours. Question 16. A female patient of childbearing age with abdominal pain should always be evaluated for option A, ovarian cysts. Option B, pregnancy status. Option C, endometriosis. Option D, PID. The correct answer is option B, pregnancy status. Question 17. A patient sustains a laceration and has not had a tetanus vaccine in 12 years. The wound is clean and minor. The nurse should anticipate option A, no tetanus prophylaxis needed. Option B, a tetanus immunoglobulin only. Option C, Tdap or TD booster. Option D, a tetanus toxoid and tetanus immunoglobulin. The correct answer is option C, Tdap or TD booster. Question 18. Which finding on end-tidal CO2, ETCO2, monitoring indicates successful endotracheal intubation? Option A, the ETCO2 of 0 mmHg. Option B, persistent ETCO2 waveform with each ventilation. Option C, PTCO2 of 50 mmHg. Option D, a flat line waveform. The correct answer is option B, persistent ETCO2 waveform with each ventilation. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient who has received massive blood transfusion protocol is at risk for which electrolyte abnormality due to citrate preservative in blood products? Option A, hyperkalemia. Option B, hypercalcemia. Option C, hypocalcemia. Option D, hypermagnesemia. The correct answer is option C, hypocalcemia. Question 20. A patient with acute pancreatitis should have which nursing intervention as a priority? Option A, encourage early ambulation. Option B, keep the patient NPO and provide aggressive 4-fluid resuscitation. Option C, administer high-fat diet. Option D, restrict all 4 fluids. The correct answer is option B, keep the patient NPO and provide aggressive 4-fluid resuscitation. Question 21. The hallmark sign of compartment syndrome is option A, pain relieved by elevation. Option B, pain out of proportion to the injury. Option C, absent pulse in the affected extremity. Option D, pitting edema. The correct answer is option B, pain out of proportion to the injury. Question 22. Priapism is a urological emergency characterized by Option A, painful, prolonged erection. Option B, inability to void. Option C, testicular torsion. Option D, scrotal edema. The correct answer is option A, painful, prolonged erection. Question 23. What is the classic sign of a basilar skull fracture? Option A, Battle's sign, mastoid ecchymosis. Option B, rhinorrhea with glucose minus negative fluid. Option C, hemotympanum. Option D, all of the above. The correct answer is option D, all of the above. Question 24. A hyphema involves option A, retinal detachment. Option B, a blood in the anterior chamber of the eye. Option C, ruptured globe. Option D, corneal laceration. The correct answer is option B, blood in the anterior chamber of the eye. Question 25. The emergency nurse suspects acute epiglottitis in a patient presenting with option A, inspiratory stridor, drooling, and tripod positioning. Option B, barking cough, low-grade fever, and hoarseness. Option C, productive cough, pleuritic chest pain, and fever. Option D, a wheezing, prolonged expiration, and accessory muscle use. The correct answer is option A, inspiratory stridor, drooling, and tripod positioning.